Hi, I'm Woo-Young Chung, track producer for this session. I'm delighted that you decide to join us for this session. A good success story always inspires us and sparks our creativity. In this session today, uh, we have a distinguished speaker who will share with us a data science success story at Parkland Hospital Health System in Dallas, Texas. Without further ado, I, I will hand it over to Scott.
Hey folks, nice to meet you. I'll start sharing my slides here and we'll dive into the session. So, Woo, can you see my slides?
So
Oh,
Scott,
yes.
we're seeing the presentation mode, like the speaker view. Can you swap views, please?
Yep. How's that?
Perfect, sir.
Very good. All right. Well, nice to be here, and thank you for the invitation to join this wonderful presentation, or this wonderful opportunity to really share our story about Parkland and our journey through the data and analytics journey we've been on for the past several years. So, when I joined healthcare, I look back to a time where most, if not all, of our records were kept on paper. X-rays, lab results, clinical notes were held in big fireproof rooms for clinicians to access and review. Nothing like today's world with the fancy integrated systems that allow each aspect of our patient's journey to carry with it their digital footprints and the ability to trace those attributes throughout their encounter to which they occurred and all the magnificent information that's captured and stored in our highly sophisticated systems of today. In 1994, that would have been like Star Trek medicine to me, nothing I could envision after graduating nursing school. You see, the county hospital I performed my nursing residency and began my professional career also taught me another valuable lesson, and that relates to the value the public health provides for a community. Had the citizens of my hometown not had our county hospital, just a short 20-minute drive away, the next closest access to care was over an hour and a half drive. So it's scary when you think about something providing that type of value for a community not being available. When I joined Parkland in 2019, I had a beautiful blend of history to draw me closer to their mission, which is to serve the health and well-being of the individuals and communities that are entrusted to our care. As the Chief Data Officer, my mission is to let data guide our actions. Two goals I have for you as we review Parkland's data and analytics journey and how it mirrors current industry trends beginning to happen more broadly across the US today. Number one is that you understand analytics cannot be a hobby or a flashy dashboard that you buy. It's an investment in developing a program, making it a priority, and allowing it to grow naturally and organically from within. It doesn't happen overnight. That's really the secret sauce. And second is that healthcare as an industry is relatively immature as it relates to data management and advanced analytics. Most healthcare systems until the mid-2010s were just wrapping up their EMR implementation and still working towards standardizing processes in their EMR, working to mature the adoption of these new technologies. So in large scale, the documentation scene was much like I described in 1994. We'll review also Parkland's response to COVID and some of the lessons we learned and how that we feel that will shape our future as a healthcare delivery organization. As we wrap up, I hope you all are as enthusiastic as me about the direction I feel healthcare is heading. Think about a day when we can identify large-scale community needs, target those communities with exact and precise therapies, and truly make a positive generational impact. So let's get started. Parkland is the second largest county hospital in the state of Texas and one of the largest in the United States. We've been serving the Dallas community for over 125 years and are the safety net provider to the citizens residing in our county. This means we provide care to anyone regardless of their ability to pay. Opening our doors to our first hospital in 1894, it was a small two-room facility capable of housing no more than 50 patients. It served our needs until 1954, when we opened the next iteration of our healthcare system, which some of you may know as the hospital where President Kennedy was taken in 1963 to receive care for his fatal gunshot wounds. Memorials on our campus still pay tribute to our fallen president. While the building still stands, it's given way to our state-of-the-art hospital that opened its doors in August of 2015. It's truly magnificent, as you can see illustrated here in the image on the slide deck. So much forward thinking and planning went into its construction. It's truly a remarkable sight to see. New Parkland, as we call it, is a massive 2.8 million square foot campus, and it houses our 878 bed acute care hospital, several outpatient clinics and specialty services. Earlier this year, we opened Moody's Center for Breast Health, with plans to open a new full service center in the southern region of our county. And we continue to work with our community partners by adding to our 30+ community-based clinics. The reason why we're expanding with all of this new facilities and services is simple. It's necessary. At Parkland, our patient volumes are some of the busiest in the nation, and we have more than 60,000 hospital discharges and 1 million outpatient visits per year. Our ED volumes lead the nation with over 240,000 visits annually. And for reference, the next closest hospital is around 210,000. As a former ER nurse, these are not numbers to brag about. They actually signify a community in crisis with a critical shortage of access to care, which is why the mission we serve at Parkland is so critical to our community. Luckily, leaders at our system value the technology and continuously seek opportunities to be innovative, allowing us to expand our human reach through the use of technical tools. My pledge as the Chief Data Officer is to let the data from these systems really guide our journey. Parkland's adoption to these technology is nothing new. It actually dates way back to 1998, when we implemented the first components of our integrated health record. This type of forward thinking was not commonplace in the late 1990s or even the early 2000s. Even more rare was that this was happening in a public healthcare space. With over a third of our $1.4 billion annual operating budget funded from local tax dollars, it's surprising we were able to accomplish such great technology feats. You see, healthcare is in a constant battle with funding, whether it's related to the shrinking budgets or escalating costs. These strains often impact our ability to do more from a technology perspective. And at the end of the day, we have to put our patients first. Everything else then becomes a zero-sum game. Fortunately, we received some very favorable funding over the past several years, and we've used those investments wisely. We've been nationally recognized in several areas as an IT division for the use of technology. Chime recognized Parkland as one of the most wired organizations in the US. We've achieved a high trust certification for our information security posture and are a 2-time HIMSS Davies Award winner. For analytics, my team was the 6th organization and first county safety net hospital that achieved a HIMSS Level 7 analytics maturity ranking. It's a very proud moment for me personally, because I could see the pride displayed across all areas of my team. The recognition they received was an incredible validation for all the years of hard work they put in to be the best, and this was their spotlight. Recently, we received an SAP Sapphire Award for the innovative work we developed and launched during the pandemic to support our mission. We'll discuss those details a little bit later in the presentation. Let's look back at the journey of how my team was formed and we grew through our advances and really what it's become today. You know, one thing to point out is that in each of the phases of the time period you see illustrated on the timeline, there's a nicely paced cadence between the investments we made in technology and then a maturing phase. Each of these phases, new technology was introduced, and then we have a pause that allowed our people and processes the time necessary to catch up, maturing key dependencies to really bring forward the value from a business perspective before we started expanding the scope of what we could take on. In other words, we were moving at the pace of our business. In 2008 and 2009, I think the statistic was something in the neighborhood of 80% of healthcare systems were largely conducting business on paper. It wasn't until the mid-2010s, when the EMR implementation boom was occurring in large scale across the US, that you began to see data programs form, just like ours did back in 2014, which I feel is a microcosm of what's happening in large scale across the US healthcare industry today. When you look at the team structure, we had a handful of BI developers that were writing static reports in Crystal against a back-end Oracle database, which housed our EMR data. Capabilities at the time, we could generate your standard tabular-based historical reports in a back office manner. In early 2015, we purchased SAP HANA as an investment towards creating a centralized, consolidated data warehouse. Initially, we didn't have anyone trained, so it sat dormant while the team didn't really move away from their comfort zone, which was, writing reports in Crystal Report land. And as luck would have it, we received a high priority request that came from our finance department. Of course, it had huge dollars associated with it. And complicating matters is that this data was being sourced from a foreign system we had never used before. It was also a gigantic data set containing millions of transactions that needed to be blended with our patient data. There is no way Crystal was going to handle this type of request. We actually needed a better mousetrap. And the final kicker was, hey, guess what? We need the results of this in 2 weeks, which I'm sure most of you have heard throughout the course of your professional careers. A couple of our curious architects, mind you, who still hadn't been through training, began downloading manuals from SAP, searching videos on the internet, reaching out to our partners at SAP, anything they could do to train themselves at plugging data into HANA. After a few days poking around, they created their first calculation view, and whammo, it worked. Not only did it work, but it was fast. It chewed through the huge data set that Crystal wanted absolutely no part of without any issues. And more importantly, the team had met that critical deadline. What a signature moment in our ethos, and really highlights the transition into the second phase of our growth, spanning the years of 2016 through 2018. During this time period, our focus was continuing to connect as much of our data platforms as we could into HANA, creating that consolidated platform. We also took on some rather hefty projects, mainly to challenge our staff in getting acclimated and comfortable in using the new tools, but we also began exploring the broad range of new functionality and built some dashboards in SAC Digital Boardroom. These dashboards that we launched as part of a learning experience highlight the transition really from back office to a more modern approach for business intelligence and analytics. The dashboards I've listed here in the center are still heavily used today. The med adherence dashboard was used to support our providers, and a study that's been published in several medical journals. It gave our providers really the ability to quickly identify diabetic patients who are at risk for non-compliance with their medication therapy. And it flagged these patients so the provider could offer alternative options for medication therapy and really improve the compliance for these folks, which is so important at preventing comorbidities and drastically could improve the quality of life for these patients. Our Code Yellow dashboard, which is used by the bed access team, consolidates data from multiple systems and shows areas of constraint that impact our ability to move patients into and out of our inpatient units, displaying metrics like slow room turnover times, recently discharged, waiting for beds. A few of these items we track on a very common occurrence just to avoid the unnecessary bottlenecks for patients that are waiting in our emergency department to get an inpatient bed to open. Our huddle board, which is the focal point for our daily executive huddle, is where leaders across multiple service lines convene each morning to provide a report of key metrics that impact our ability to keep hospital operations running smoothly. When you fast forward to our current time period, we continue to make incremental investments in both our technology and people to support a growing appetite for data across Parkland. All of this growth seemed to culminate at really the most opportune time as we enter 2020 and begin learning about this new disease, a virus that was entering into our country. Serendipity or great planning, I'll let you be the judge, but COVID was a very interesting time in our history. With more than 200 data sources connected to HANA, some with live streaming connections, we now had the ability to serve timely and relevant data to our leaders across the organization. Wow, what an advantage this provided at various phases throughout the pandemic, and was a real game changer for Parkland. Listening to my industry peers, several of whom struggled to get their teams to deliver basic reports, it reminded me of our time back in 2015 with our financial report, and how thankful I was to be where we were in our digital transformation journey. The biggest impact we actually felt as a team was when we had systems that weren't connected to our warehouse, but they were needed for reporting. Most of these were legacy systems that were on the roadmap for replacement, but hadn't been decommissioned before COVID hit. These became critical fixes and put a heavy burden on all of our teams, and a technical debt we don't intend to pay again. This is why we're in the race to space. We can't move fast enough to migration into the cloud. These multimodal platforms offer us the best advantage we have to flatten our costs and maintain our growth trajectory. You see, healthcare as an industry is moving swiftly in its shift to virtual care space, which is great for the patient, but the puzzle for chief data officers to solve is how to integrate these systems of engagement like wearables, patient-owned devices, monitoring technology quickly without compromising our data quality. This will be part of every CDO's strategy in the near term. Personally, I feel big tech will play a critical role in changing the landscape for healthcare. SAP, Amazon, Microsoft, Google, all non-traditional players in healthcare, are bringing very robust tools that have been matured in other industries and offering some much needed disruption with their cloud platforms. Very interesting to see how these disruptions will change the narrative of my timeline within the next five years. Certainly exciting times for sure. COVID, oh boy. What a ride the last 18 months has been. One of our chief physicians in describing the pandemic said, "It's like yesterday, and it seems like 10 years ago," which I feel like sums up the past 18 months very well. It's like no other time I can remember in my 25 plus years in healthcare. But the silver lining is the many valuable lessons we learned during COVID, we commit to carry these forward, and we'll get better from it. In January 2020, as my team was celebrating our HIMSS recognition, we began hearing our hospital leaders giving updates each morning during our executive huddles about this new virus spreading overseas but hadn't reached the US yet. Over the course of the next few weeks, that narrative had changed to, we now have our first case in the US. I believe it was in Seattle or somewhere in the Northwest. And then a few weeks later, we now have this first cases in Texas, not anywhere near the Dallas-Fort Worth area. And then over the next week or so, that had changed to, we now have our first patients in Dallas County, one of which arrived to Parkland to be admitted to the hospital. That occurred in March 10th of 2020. From that day onward, data became popular. We were finally the cool kids on campus. And we were providing what came to be a very critical tool that supported our front lines, who were locked in a battle to keep our hospital operations flowing and preparing the best that we could. Initially, we were largely receiving requests on how many cases were we getting, how many testing kits did we have available, what were our inpatient beds looking like, how many isolation beds did we have enough protective equipment for our providers. All of these requests became the inception of our COVID Command Center dashboard, which was developed and launched in a matter of days. As we were locked into a disaster response, this tool replaced our huddle board as the focal point for cross-collaboration among our leaders in Parkland. It was displayed in a live streaming feed across multiple big screens in the command center. And several folks, who were still working in their office would leave it up on their workstations to watch live as these numbers were changing by the hour. They were watching trends almost like a stock trader would, and constantly using this to make critical decisions. In fact, we had a small downtime last June for an upgrade that took our dashboard down for just a short period of time. Even though we had communicated it broadly about the planned outage, the escalation calls I received forced our governance committee to list SAP HANA and Digital Boardroom as a tier 1 IT system. meaning that any downtime event or slowness that was detected in our system, it was caused to implement our IT disaster protocol and rally an all hands on deck type of situation to get that system back online and up for use. Truly new territory for our team. It's not often you see analytics play that kind of a forward-facing role. And signified yet another moment. The fact that our products had reached this level to our customers really provided us the momentum that we needed to continue advancing our products and capabilities. I want to shift gears just a bit and show you some of the illustrations of the content that we created during the pandemic. And it really helped, these are what helped us achieve the SAP Innovation Award that we recently received, but it really provided value for our frontline staff. While these products were excellent, one of the things that I want to point out is that these were designed, developed, tested, and launched in a matter of days, unlike the days of the past where it would take weeks or months to get these things designed, developed, tested, and pushed out. And then we always had adoption to worry about. Showcasing this type of agility that we now had with all of these systems connected to our centrally sourced platform is really, what helped push this out with that type of agility. The first thing that you see is a geo map that we developed, helped us in a couple of different times throughout the pandemic. We developed this architecture that coded the latitude and longitude of Dallas County down to the block group level, which I think one of our data scientists said was accurate up to 300 feet. Early on, what we used this map for was to highlight positivity rates as they spread among our communities, and partnered with our county health department to deploy mobile vans and testing drive-ups that we could use to really reach out to our public in the communities that had the heavy needs. Things like food insecurity were the primary issue impacting most of our zip codes and their ability to quarantine appropriately. So reaching these communities with information, testing, treatment, updates, ability to address social determinants was really something very important. We later used this map in a similar manner to perform outreach in the communities for vaccine sign up. The second illustration that you see on the screen was developed, it was a critical inventory tracker. If you remember early on in the pandemic, much of the concern across the country and not just here at Parkland was, do we have enough personal protective equipment and critical care supplies, things like ventilators, the gowns, the gloves, the N95 masks. We caught wind of our folks that were out there counting these supplies and literally using clipboards and paper to track them on. So we repurposed a survey tool that we had in SAP Qualtrics to create these forms for our folks to use in tracking these critical supplies. The ability to use a smartphone or a tablet and laptop to capture these metrics discreetly and display them real time on our dashboard significantly improved the data integrity for monitoring these important items. The third thing that you see was our staffing numbers. Similar to the critical inventory, we used Qualtrics to display our staffing numbers and highlight areas of our units that may be understaffed or appropriately staffed. And this became very important to our nursing and physician leaders who needed to ensure we had enough staff or an accurate staffing count because folks at that time were having to be turned away from their duties if they were asymptomatic and tested positive. So staffing became very critical, and this was one way that we helped ensure we had enough staff to meet the demand of our patients. 4 is a line graph. It illustrates a predictive model that we built that was based on mobility patterns in our community. Each time we saw the mobility of our community move above the 1.0 metric, we could predict very accurately a spike in the cases arriving to our hospital, providing a 7-day forecast on things like, what are our ICU beds going to look like? What's our ED volumes going to look like? Mortality rates, how bad will it be? Initially in the pandemic, we had plugged in a couple of the models that were circulating the country, and it provided a very scary outlook. The numbers just didn't add up. When we started plugging our numbers in, I think the initial model said that we could predict somewhere in the neighborhood of 18,000 arrivals during our peak surge. And that just didn't add up with what we were seeing. So our data science team at PCCI really worked with our Chief Medical Informatics Officer, Dr. Moran, to create this model that we operationalized and was used within our command center to give some comfort to the folks that were manning and staffing our units. Number 5 and number 7, these were used simultaneous together. These were 7 is an employee screening questionnaire that, once again, we used Qualtrics to capture symptom questions, and if patients were, if employees were asymptomatic and were cleared to show up for work, the algorithm would push out a little quick visual indicator you see listed in number 5 that allowed them to show the door screeners entering the hospital to give a quick visual that says, hey, you're cleared to show up to work. You don't need to stand in line and wait to get through these lengthy lines. Number 6 was the conversational AI chatbot that we co-developed with our partners at SAP. It was on the front page of Parkland's public-facing website, and early on it helped guide our community through the decision-making process to determine whether they needed to go seek a COVID test and where they could receive it, significantly lowering the call volumes for our call centers. Each of these tools, once again, were developed and operationalized with our key stakeholders at the elbow, guiding us in each phase of the process. What was cool is that it wasn't an IT thing. We weren't pushing them to adopt this. These were things that they had asked for, leading to a much quicker adoption of the tools. As a public health entity, our mission is to serve the community, and the CHNA, or which stands for our Community Health Needs Assessment, is really Parkland's strategic North Star, and a plan that was developed in collaboration with our executive team, the County Board of Commissioners, and our community partners who look at focus areas of our health disparities and develop programs to address the important needs within the community. Our current plan has 4 strategic priorities, and they address things like chronic disease, hypertension, diabetes, asthma, maternal child care, so lack of postpartum care, we address those issues through this program, infectious disease monitoring, behavioral health services, which often influences our ED volumes. Not surprisingly, each of these programs in the CHNA is heavily dependent upon data. So the leaders developing this initiative really developed KPIs to go with each of the programs to measure the efficacy of interventions. And these metrics are also used to provide transparency to our board and community as we report these out on a very routine basis. The data you see illustrated in the map of Dallas County show areas of need, which are illustrated in the maroon shading. The deeper the maroon, the heavier the need. With the darkest shaded zip codes, are residents living at or below 200% below the federal poverty level. Note the correlation on our map to the one on the left, which shows where our community-based clinics are, highlighted in the purple dots. They should mirror those areas of the deep need, and really is our focus for the future. We must understand what the health influences are for those communities and target them with precision medicine, which I feel will provide a generational change for these families and really embodies the value of public health serving its community. To support this vision long-term, I had the pleasure of sponsoring back in 2019 a really important project where I borrowed concepts from the business world, which is to know thy customer. Applying these same concepts to healthcare, I wanted to know thy patient, and really create a data model for my clinical and business leaders, the goal being to provide a multi-dimensional view into the information necessary to answer questions like, where should we put the new clinic? What services should we focus on at that clinic? As we continue expanding our footprint in the community, this allows us to be very strategic and deliberate with our spending and provide the biggest value to our community. The data was huge that we evaluated. Our partners at PCCI evaluated data spanning over the course of 5+ years of encounters. And the idea was that we wanted to create 6 to 10 cohort groups. I think we ended up with 8 that all contain similar attributes, which 56 in total. These were shared across all of the 8 cohorts and ended up being a pretty strong data set. And they showed things like the ethnicity, the race, the age, number and types of encounters coming from various areas in our community, whether they had insurance coverage or not. What were the utilization patterns of our patients? What services did they need? Did they belong to a disease registry? All of these things would essentially serve as a target audience for our community health workers who are charged with managing the operations of our CHNA program and measuring its success. So these are a couple of examples that were produced as an outcome of the project. And it was really fascinating to discover what we thought we understood about our patients and what new discoveries we uncovered. Any of you in the healthcare space should consider a very similar exercise to get to know and understand your community and seek to understand what influences their health equity. Really look for those opportunities to promote health before it becomes a disease you must spend valuable resources to treat. So a couple of questions I'd hope to answer today was in the valuable role data will play in the future of healthcare. As we continue to improve, things like precision medicine through population health outreach is really our future, and one I'm happy to support. We showed the value data can play over the past year and a half, supporting our front lines during the pandemic. This common enemy we took valuable lessons from and offer us a clear path forward to really change the lives of the folks who deserve our attention, applying the deliberate use of technology and letting data guide our journey. Thank you. So
Wu, did you wish to facilitate any questions?
Sure, we've got a little bit of time here on the docket, so if there are any questions, happy to field some from the audience. Let's see here. So here's a good one. How have you and your team gained buy-in from MDs on using data to help them improve their decisions and recommendations to patient? And I think that's a great question, and it really highlights one of the things that we've been working towards since I've been at Parkland over the past 2.5 years, and that's really that technology, data, and analytics. It's not an IT thing. You really have to pull those folks in, and if they're reaching for something, that means it's providing value. If you have to push and force them into using that, it's something that probably isn't providing a lot of value, and quite honestly, they're going to push back against it. So I think some of the things that we learned early on in the pandemic really highlight some of the parts of this question that, adoption really means that you need to have them ask you, how can you help me? So be at the table. Interact with those leaders and make sure that they understand that you have the capabilities you have, and let them guide you in what products and tools you want to develop. And I see another one here can you please share with us what was the biggest challenge in your data journey, and how did we address that? And I think, I'm going to give you two answers here. I think this is one pre-COVID and then one post-COVID. And I think, the short answer for pre-COVID is that when I arrived at Parkland, it was, data and analytics was an IT thing. It wasn't something that we had really built the trusting relationships up with our clinical community. And so we really sought out to get out into our business community and start interacting with those leaders and exposing them to the tools and stuff that our team had spent years creating, but maybe really didn't do a great job at publicizing widely across Parkland. So that's really what our focus was early on, from early 2019 through early 2020, And then ultimately it culminated in our HIMSS recognition in January 2020, which was to display how actionable analytics could really impact the healthcare organization. And to do that, you needed to get the business customers and clinical customers pulled in and helping you show the value of these tools. And then secondly, the biggest challenge that we had during the pandemic by far was the systems that we didn't have connected to our platform. Those systems were a real challenge, whether it was just they were old and needed deprecated, but didn't have the ability to go through that process. They were still living in our ecosystem. They oftentimes didn't want to play nicely with any system. So, getting data out of those and being able to use them became a critical fix, not just from a data perspective, but across our IT division. So, always look to that with that eye towards the future of how can I get these systems updated, upgraded, and maintain that as we go through our journey. The constant growth of regulatory demands, I think that's another point that someone brought up in the chat. Regulatory demands are oftentimes creating the need for us to show agility within being able to curate data. Whether this regulatory is financially related or has been proven to show better outcomes for our patient, I think that is key in making sure that we are really driving the value from our technical investments. And so, the consolidated platforms were really the game changer from an agility perspective. So if you haven't invested in a consolidated platform, these multimodal systems are really cutting edge. It should be on your roadmap because it really is going to allow us to do way more with flattening our cost and maintaining a lower FTE footprint to integrate these data items in and make them the data and all of the other systems talk to one another and create that business value. All right.
One of the interesting question from the audience was that was asking how your experience, all this wonderful experience, how would you, as a sort of what coming up next, how would you apply to other aspects of healthcare industry or even outside the healthcare industry, other business or even government agencies and so on?
Sure. Yeah, I think, in large part, like I illustrated early on, healthcare is relatively immature as it relates to technology. And certainly from a data perspective, it's very immature. And it'll get there. I think, the introduction of our integrated health records, these integrated EHRs are very, very technical, allowing systems to talk to one another. And I think that the ability to move from that system of record into a more blended, diverse universe where you're connecting all of these various systems that are used across healthcare really allow us once again, that agility to start meeting the demands of our public. And then when, wearables and patient-owned devices are really, really becoming a fast-paced need for us to start considering in our data strategy. So, the ability to take these systems of engagement and integrate the data items and make them available to our clinicians is going to be something that we have to tackle sooner than later. I think you'll start seeing more payers get into this space where, we're taking some of their data, integrating that in and making it usable for our clinical and business leaders at the healthcare system. So I think short answer is you've got to build agility and maintain that. So however that's accomplished, I think that should be the focus of your strategy.
As you begin to share more of data and use it more leverage on data, do you see any challenges in terms of cybersecurity, security issues?
Sure.
Especially if you go into things like wearables and IoT devices and so on. And we also seen some of major hospital having issues with the cybersecurity. Could you address some of those points?
Sure, and everything that you just mentioned is absolutely on, should be on the forefront of everyone's mind, not just in healthcare. I think all areas of our industry, we really have to be diligent as a society in protecting ourselves against these attackers. But, one thing that I'm very proud of at Parkland is that our IT division has taken information security as a very, very serious concern. So the high trust certification that we received really validates multiple areas across our information security posture to try to identify gaps or areas of weakness that we need to button up. And it's not an easy accomplishment to receive that type of recognition. So making sure that we have that type of recognition allows me now to venture into the devices and wearables and things like that, and really showcase that these systems are not going to impact our ability to maintain safeguards over the bulk of our information that's stored here in our data center at Parkland. So I think that overall the high trust certification was really kind of that value add that helps us maintain that security posture. Okay. Well, thanks everyone. I don't see any more questions coming in via the chat. So Wu, I'll turn it back over to you.
Oh, okay. Um, Actually, I think there was another interesting question here. One of audience, a question from audience was the what are the structure and governance changes you are implementing to sustain the momentum post-COVID?
Oh yeah, yeah. I see that here. So from a governance perspective, we have a data citizen economy here at Parkland. So in other words, we have a centralized enterprise data services team that really acts as kind of the central hub for making sure that all the technical aspects from a data perspective are maintained. So what we're establishing is that community where our business leaders are able to create an ecosystem where they have abilities to hire folks that are embedded within their business and able to use our technology tools. So the idea is that we wanted to build a hub and spoke type of model that allows us to make sure that these business leaders never had IT as a barrier to retrieving data. So we really wanted to make sure that we were influencing them with best practice. And so part of the reason why we went through our HIMSS validation was not necessarily really out of hubris. It was more out of, hey, we wanted to make sure that we were operating at the highest industry standard from a process perspective. And so we felt like that validation would really, uncover areas that we needed to work on and improve to make sure that we weren't, as we were supporting a distributed build model, we weren't influencing those areas, promoting bad behaviors. So, last thing that we wanted to do was create an environment where, inadvertently folks could mess up the architecture that would impact our entire organization at the enterprise level. So, our governance is really, started internally within my team that we said, hey, these are the industry best practices we know we need to follow. Let's build a business framework around each of those areas and then use that as a guide that we could promote through our distributed community. And really, that's taken off to be very, very successful. We have probably 5 to 6 very high functioning groups that really model what we started and put forward prior to COVID. And then during the pandemic, we really found a lot of value from those groups as they, they were able to take their business consumers and really, work without having to have any barriers from an IT perspective at delivering analytics. So, that center of excellence model, which is what we've coined it here at Parkland, is really something that we plan on supporting long term from a governance perspective, and making sure that we're really able to deliver that business value throughout all areas of our hospital system.
If I may ask a quick questions about the, let's say, if there is someone who got promoted or just got a job becoming a CDO, Chief Data Officer at the healthcare system, what would be kind of personal or professional advice you would give to that person just to get them started on their career?
Well, first of all, if you're in the healthcare space, which is where I'm going to draw my experiences from, so I'll speak from that perspective. Healthcare is a very dynamic environment. You have to be able to absorb changes that are constantly happening. Somebody brought up regulatory changes. That's occurring all the time. In the public healthcare space, which is the area that I serve, oftentimes our funding is a result of various election cycles and different political agendas. So just being aware that you never know what tomorrow is going to bring. So make sure that you understand, as you're going through and evaluating and understanding your team, that you understand that not every organization is built alike. Here at Parkland, we're a single county hospital. I've worked as a consultant in other healthcare systems that have 10 or 12 or 15 hospitals affiliated with, and some of them may be on varying degrees of EMRs that have different challenges from a data perspective. So just get out there, understand what your business is and who your customers are, both internal and external, and then start working to establish a business framework that's consistent across each of those enterprise areas. And then making sure that you measure, you create standardized processes for each of those groups to follow. I think that's key, is really focusing on just getting out there and embedding yourself into the business and providing a standardized approach to the way they handle data, the data lifecycle management.
You're muted, Wu.
Me
We got you
see.
now.
Oh,
Yeah, we
okay.
hear you now.
Okay. Sorry. I just checked it and see if there was any questions. I think it's kind of a, we can probably conclude this session. I do really appreciate your presenting your experience. It was a really fascinating story, how it going into going through the post-habit, post-COVID, and the going through the COVID, the pandemic, the challenges. I really, it was very, very, how should I say, it's a kind of live experience. I could almost feel the pressure at that time and so on. And I do really appreciate sharing your experience and also lessons learned.
Thank you. I appreciate you guys having me, and I hope that the audience found something valuable that they can take away and maybe apply to their own areas of industry, and hopefully help from some of the lessons we learned over the past 18 months. So yeah. I appreciate you having me. Thank you, guys.
Thank you. Thank you. So why don't we then maybe we will conclude this session here. And I would like to also say thank you to all those who attended this session. Our next session is, sorry, I don't have it here in front of me. I think it starts at 2 o'clock. Yeah, it
2 o'clock.
starts at 2 o'clock. So it's a lunch break. we'll we'll get started on lunch a little early. So I will see you. I'll see everyone back here, hopefully on our track, track number B, track B. We'll see you at 2 o'clock.